Hi, my name is Dr. Ross Hauser. You're here in the Florida office of Caring Medical Florida here in Fort Myers, Florida. I'm here with Jeannette, who's, I'm a little bit of your body mechanic, huh?
Right.
Like, you kind of,
Yeah.
and you're absolutely an active lady. And like when people get diagnosed with spinal stenosis, it's almost like if they go to a surgeon, the surgeon actually doesn't give them any treatment options. So why did you believe that maybe there was a treatment option, which was prolotherapy? And what was your response to prolotherapy for your spinal stenosis?
Your question number one of the part was because I don't like surgery and it's terrible to hear about it. And number two, how I was treated when you treated me for my spinal stenosis. When I came in here, I could barely walk. And as each day progressed, with my body healing me from the inside out, and with the treatment that you provided to me, allowed me to be back on the golf course in 30 days.
So you just sought out alternatives? Was that what it was?
Alternatives,
Okay.
but I'm very much aware of what prolotherapy can do for me.
Oh, okay.
Right, from prior prolotherapy treatments that your books have given other prolotherapists in the state of Florida.
Oh, okay. Gotcha.
Right.
And then, are you able to walk pretty good now?
Yeah, I can walk pretty good.
Okay,
Yeah.
good.
But it's a tingling type to get there.
I gotcha.
Yeah, but the spinal stenosis, yes, I really feel fortunate with that. But I'm not going to go out there and do jumping jacks
Right.
to get anything stirred up.
So you would absolutely recommend if somebody has spinal stenosis in their back to consider at least getting an evaluation for prolotherapy?
Getting an evaluation, get a treatment, and see if you can treat your body good enough to heal it. You got to heal it.
No, we appreciate that. And then you actually, today you came in with a new problem, which is actually kind of interesting, right? Because you were doing really well, you're back on the golf course, and things are going good. And then tell us what's happened. Like, why'd you come today?
I came today because this foot problem with mine keeps tingling more, and as the sun goes down every day, it keeps tingling more, and it's very uncomfortable because I can't sit and relax and put my foot up or put it down because it's tingling.
But the nerve conduction study that you had showed that you have an injury to your superficial peroneal nerve, and the superficial peroneal nerve that innervates like the top of the whole foot. And then you said to me that not just that you get the burning pain, but there's like kind of getting some numbing.
Right.
Like
Numbness.
like it's starting to get numbness. So in other words, when a nerve gets hit, the first thing that normally happens is that you get a burning in the distribution of the nerve. And that nerve goes really close to the fibula bone. It goes really close to the fibula bone. The peroneal nerve wraps around the fibula bone, then goes into the top of the foot. And then, so you and I had talked about that normally that nerve gets injured by ankle instability, then the bone starts hitting the nerve. But I was concerned because the fibula bone also connects up here. And then you had what did you have in this knee?
This knee, I've had 2 knee replacements. The first one, the prosthesis started protruding out through the limb, and so I had to go back the second time and have it done in 2015.
No, and you understand that wasn't actually that long ago, so 2015 isn't that long ago. So in other words, you had a replacement, then the replacement got loose, then they had to go in there again, and then sometimes after replacements, the ligaments don't tighten all the way.
That's correct.
So what I did was then I examined this knee, and then I said to you, did you feel that clunk? Like, it's not normal to move the knee and you have a replacement and you get a clunk. So the clunk means that you have looseness of the knee on this side. So the fibula bone on your right knee, it's loose here, and then the connection down at the ankle's loose, and that's what's causing your superficial peroneal nerve irritation. So initially when the nerve gets bumped by a bone, you get like a burning pain, but if it keeps getting bumped, you're eventually going to get numbness, because eventually the outside of the nerve is going to get damaged. So the more that a person has numbness that persists, more that you have a numbness persists means that you have to not just do prolotherapy so the nerve's not getting hit, but you actually have to do nerve regeneration. And that's when we put like PRP or stem cells around the nerve. But in your case, because you're coming in relatively early, like it started when?
I don't know. Sometime in the past year.
Right, so because it's not years and years, I'm suggesting let's just do prolotherapy today, and then hopefully the numbing thing goes away, and then the burning pain goes away. But do you have any questions?
No.
Okay.
It just, why weren't you around before they replaced these knees years ago?
Thank you, thanks, Jeannette.
I would never
Thanks
have had
again.
my knees done.
You're
Never.
a good example of like you have got to stay walking. Like how old are you now?
81.
No, but you know what I mean. I think in the year 2019, we all should have a goal of being active, to the age of 90, and then after 90, well, every day is a blessing. But you have to stay walking because if you stay
Right.
walking, there's a very good chance the 80s will be amazing for you. And of course, once you stop walking, man, it's a downward spiral really quickly.
But this foot hasn't allowed me to, well, I've had some stressful things in the household, but
Okay.
this foot hasn't allowed me to really comfortably walk
Okay.
for probably the last 3 to 5 months.
Okay.
Yeah.
Okay, but the prognosis is very good with prolotherapy.
Okay.
Thank
It
you.
is. Prolotherapy
Thank you
works
for
good.
sharing with us today.